Hello, everyone, and welcome to our Tuesday night chat, our community connections. This is where we get together on a Tuesday, and it's the last Tuesday in May. So we have a very special extra guest tonight. Welcome, Jen Draper. Tonight, so let me introduce myself. I'm Kelly Wilkins, your host of Myself Reliance, and if this is the first time that you're joining us or watching our replay, then you can join us every Tuesday. This is where we're at on 7:30, and we cover all kinds of topics. This is the last of the health and relationships conversation, and then in June we're going to move into finances. So stay tuned for that. We have a lot of great speakers lined up for you to talk about finances as we head into the end of the financial year. But first of all, I just want to tell you about this weekend's tiny home event in Sydney. If you are anywhere in the Sydney region, you want to get along to the tiny homes, either the Friday, Saturday or Sunday, and especially on the Friday night, register for the Beyond First Aid workshop with Isaac. And it's going to be an awesome workshop because he is military medical trained, and so we're going to learn a lot with him. So in addition, in 2 weeks time on the 11th of June, it's a Thursday night, we're actually going to hold a separate really important Zoom for anyone in the Queensland, anyone who knows anyone in Queensland. Jump on, we're going to launch our Queensland hub, so that'll be a lot of fun. We've got some fun things planned, and you can find out all about what it is to be part of a hub when you jump onto that meeting. The link to that is in Telegram and on the email. So if you're not already getting my emails, then send me a message to kelly@myselfreliance.com.au, and I will add you to the newsletter that comes out about 3 o'clock on a Tuesday afternoon. Well, without any further ado, I want to introduce you to our beautiful Dr. Jen Draper. And let me tell you, I'm going to read to you her introduction, and then I'm going to share the time over to Jen. So tonight is titled Unpatient, Stopping the Habit of Outsourcing Yourself. Former medical doctor, Dr. Jen Draper, shares a deeply personal and professional journey that led her to walking away from a conventional medicine and create the Unpatient Way, a new paradigm for healing rooted in the nervous system regulation, self-trust, and embodied inner authority. After nearly 3 decades in clinical practice, Jen recognized that many high-performing people are not broken. They're exhausted from living in a survival mode while disconnecting from their own inner wisdom. So tonight, this talk explores why burnout, anxiety, overthinking, relationship struggles, and persistent health issues often remain unresolved despite doing everything right. Drawing from her upcoming book, Unpatient, Neurotransformational Therapy, and her evolving work supporting doctors, couples, and individuals, Jen introduces a compassionate framework for moving from survival-driven performance into regulated clarity, self-trust, and authentic well-being. This is not about rejecting medicine. It's about remembering the wisdom of the body, reclaiming personal authority, and becoming an active participant in your own healing journey. And I want to add to that our beautiful Jen has the most exquisite way of listening. So if you've ever been able to be in her presence when you're having a session with Jen, I can speak from personal experience that she is the most amazing listener that I've ever come across. And so when you're delving into all these uncovering transformation in your life, you really want to be with someone who knows how to listen and to explore what's really going on deep down for you. So thank you so much for being here tonight, Jen, and for sharing your wisdom with us.
Thank you, Kelly. What a lovely introduction. I'll have to make sure that I update that because it is not an upcoming book. It is actually a published and already available book that is
Hooray!
called
Launched.
Unpatient. Yes,
That's very exciting.
yes, it is. So I will share my screen, just making sure everybody can see that appropriately. Very good. Thank you so much. And I'm going to be completely transparent within this presentation tonight to let you know that this is my unofficial dry run for a masterclass that I actually am going to be rolling out from the 6th of the 6th, 2026, which is Saturday week. And my initial ambition is to roll this out 3 times a week. So that 3 times a week, I will be presenting these slides and speaking to them with whomever it is that decides to show up at that session. So this will be a free masterclass that I am rolling out. And it has taken me some time to come to this point that it is a good thing to do things for free because I know that having had a career of nearly 30 years in medicine, I have basically felt like I've been working for free for all that time because, of course, in Australia, we are so blessed to have this amazing universal health cover system called Medicare. And for nearly 30 years, I was a medical doctor. So I was effectively feeling like I was working for free because I was basically just getting the Medicare rebate for whatever item number it was that I chose to attribute to the service that I provided to patients who would come to see me over 30 years. And it was during that time that I accumulated this wealth of knowledge that I recognize has given me some particular insights into the way that the system works. And I'm going to share that with you tonight. So you'll notice that the word unpatient doesn't have its little squiggly line, as in this is a misspell, because I've gone through and added it to the dictionary. But unpatient is a word that I came up with when I crafted this book, and my intention with that book was basically to correct the misbalance that I see between the doctor and the patient, or if I want to use my hands, between the doctor and the patient. And it really shouldn't be like that. It should be like this: doctor, patient, we're all people. We should be on a level playing field. And the best doctors recognize that you, coming as the patient, are going to be in fear, in a place of discomfort, and often desperation, because let's face it, who really wants to go see a doctor in these days? So I realized that this is not going to be a talk about bashing medicine or rejecting medicine, as I've said, but it's going to be a talk about reclaiming the balance that should be there between the doctor and the patient, in that we are all people and that you are the expert on you. And the subtitle is Returning Home to Yourself in a World That Profits from Your Disconnection, because the subtitle to my book, Unpatient, How to Rebuild Self-Trust in a System That Profits from Your Ongoing Disconnection, basically comes from the fact that what I observed over nearly 30 years is that people who come in with signals that they are reading from within their body, within their essence, whether it's mental, physical, whatever is the signal that they're getting, they are just seeking for some kind of interpretation for it within a system that they have been indoctrinated to believe is the system with all the answers. And I hope that by the end of tonight's talk, you will recognize that that system profits from you being disconnected from yourself as the authority. So let's go on. So let's have a little think and see if any of these statements uh, do describe you. Who's ever heard a doctor say to them, well, your tests are all normal, but you know that something just doesn't feel right? Or who's ever, and I want you to write in the chat if this applies to you, who's ever felt so exhausted and they have a great night's sleep, but they still feel exhausted when they wake up? Or Sunday evening when you've got to go to work on Monday and you've got this feeling in the pit of your stomach, like, why is it that I feel so uncomfortable just because it's a Sunday evening? Or you have this amazing success in your career and then you feel this empty hollowness afterwards. Let me know if any of this resonates with you. Or let's have a talk about the gap. On the outside, here you are being highly successful, driven, getting all of these accolades in your profession, but inside you kind of feel like, well, what's the point? And obviously, if you've got a purpose in your life and you feel connected with that higher purpose, that may well not appear to you, but you still may be feeling like there's a gap there because you've got this soul driven contribution expansion need that you have, which may be fulfilled through your faith and being charitable and giving to your community, but yet the system indoctrinates you to be of purpose and to be fulfilling your wins, etc. And you're doing all of that, but yet inside you've got this hollowness. So I'm introducing this concept of three, and I'll be talking to the three multiple times during this presentation because it's a very important number for me. Yes, thank you, Simone. I'm glad you appreciate this. Or let's see if number 4 might apply to you. You've actually finally decided that you need to make a doctor's appointment, but do I really need to go? I don't want to waste anyone's time. So you kind of belittle your symptoms or your messages, your signals that you've been receiving because you don't want to be seen as wasting anyone's time and you don't want to draw unnecessary attention to yourself. But on the other hand, you're somewhat fearful of what the authority, the doctor, may tell you when you tell your story. Anyone else relate to these things? Because I can tell you, through my 30 years in medicine, what I used to experience was all of this. And also, straight away, when something would happen to me, I would kind of think, oh, da 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 da. These are all the things, worst case scenario, that could be going wrong. It was pretty scary. But of course, I wouldn't go to a doctor. Physician, heal thyself. Now, when you come, let's have a think about that when you actually do make the effort to go into that doctor's appointment and they, ask you 20 million questions and you're kind of like trying to find the answers and working out, oh, what is it that they want me to say? And do you ever find yourself saying what you think they want the answer to be? I certainly used to because, well, in doctor's appointments, when I eventually, at the end of my career, I did have to see a doctor. Sorry about the emotion. It was, yeah, it was difficult. Yeah, but it gave me the compassion to recognize how other people had felt for so many years with me. And I used to be like this in all of my consultations. Oh, here comes me. Come here. Come here. Come here. Um, there we go. Comfort doggy's here. Mummy's good now. Yes. Yeah. So what used to happen was because the pressure was on me, this is as the doctor, not as the patient, okay? So tears aside, although tears used to happen as a doctor, which was basically why I couldn't go on. But when I was the doctor and the tears would come, years before the tears were coming all the time, I was so under the pump with the timing as to how I had to push people into giving me the answers. And so when you come along into a doctor's appointment and you feel like they're pushing you for time, well, guess what? They are. They are pushing you for time because they are pushed for time. Everything runs on schedule, bang, bang, bang. And the point is unless you are prepared for that time pressure before the appointment, you will notice that you are feeling like your story doesn't matter because the time pressure that the clinician is under is basically making you feel like you have to get out those essential details. So, one of the things that I want to explain to you is that this is not your fault. This is a fault of the system. Thank you, Katrina. I get it. I completely do, especially when you want to feel heard and you want to feel like you're being held in a container. Because let's face it, most doctors are not bad at holding space for people. They're just so pressured by the time that is coming from the system placed upon them. So, one of the principles that I just want to share with you is that the system doesn't hold space for the doctor or the patient. And yes, I think a pre-appointment details and surveys is an incredibly useful skill. And you, if you're not attending a medical facility where they have those, can actually take it upon yourself to do that beforehand so that when you are under pressure in the heat of the moment and you know you've got a 6 minute consultation, if you're getting bulk billed, if you're lucky, then you already have got the information organized in some kind of a manner wherein you know that you will get those important points across. And that will then mean that when they interrupt you, you don't shut down, that you can direct them back to what are the points that you want to be held and make the point in that space. But the point is if some, as I said, if you're unlucky enough to have to actually find yourself in a health professional's appointment because something within yourself is causing you distress, then you are naturally going to be feeling that pressure of something's wrong with me. So what the hell is it? Okay, I'm quite fearful. And when we become fearful, the neuroscientific explanation for what is going on is that our sympathetic nervous system will become dominant, and that's the sympathetic nervous system is the fight, flight, freeze, fawn, or fight, flight, fright. Did I say that correctly? Anyway, you get what I'm saying. It's the accelerator. It's not the brake. So the accelerator is trying to get you out of there. The brake is the rest and restore. So you've got to try everything that you can, or don't even try because there is only do. Be in that state prior to the appointment wherein you cannot be accused of being bad at explaining. You can recognize the time pressure that is upon the both of you, and you don't have to rush it because you're already prepared. You've put yourself into the rest and restore state, written your notes, write a list down. What I used to do when people would come in with a list is I would say, fantastic, you've brought a list, give it to me, and take the list from them because the list would have all of these different points, and the medical paradigm within my brain would go, oh, these are all connected, and you'd get through things so more efficiently. So that's a really, really great reframe to have, to recognize that you are in the fear, but guess what? So is your doctor because they are under the pump of the time pressure. So I hope that's helpful. Now, we call people patients because they're always waiting. They're waiting for the permission. Come on in. Waiting for certainty. Oh, no, it's not that. Oh, it is that. And they're waiting for someone else to tell them who they are or what's wrong with them or what's not wrong with them. So when I wrote my book, The Unpatient Way, or Unpatient, How to Rebuild Self-Trust in a System That Profits from Your Ongoing Disconnection, I spoke about stepping out of this waiting room because You are the expert on you. And as we'll talk about a little bit later on, I studied Latin during my high school career because my stepfather was a Latin teacher and he told me it would be useful because I wanted from a very early age to be a doctor. It kind of fit with the fact that I had terrible handwriting and like from my early reports, the handwriting was just, well, everything else was fantastic. So patience actually means to wait and suffer. So if you're going to stay a patient, then expect to wait and suffer. So stay in the waiting room as a patient, or you can look at becoming unpatient and just dip in there whenever it is that you need whatever it is that you need from the system. And I know many of the people in this community, as opposed to the people that I'm going to be speaking to when I'm presenting this masterclass regularly to the general public, are not going to be as enlightened as you are. So I appreciate that this may not be so useful for you guys. But if on the off chance that you do find yourself in a scenario where you have to attend a medical facility, then maybe some of the tips that I give you will be useful. So, about me, okay, I was a successful doctor, but as you could see, I still have a lot of stored emotion within me that is just energy that needs to move. Whenever I speak about being a doctor, I still get quite tearful because there is an amount of grief that's there. And part of the reason why that was because I helped everyone for so long. And so many people who I recognize now are in a similar situation. They're great at helping others, but not so good at helping themselves. So I was the last one that I was looking after. And I'm not broken, I'm just really disconnected. I don't like to connect in with those painful parts of myself wherein I have these held on to bits of stories that say things about me that relate back to my previous experience or my past lives or past generation or whatever. All of that still needs to be released to be in a place where, emotion is energy doesn't need to move. Energy is just there within me and it's balanced and I can hold space for people. And it's much, much easier for me to do that when I'm listening. That's probably why Kelly said I'm such a good listener because I can just hold my own energy and be open and receptive to the energy of whomever it is that I'm listening. And then what I do is I tune in to my body as I'm listening to someone and I feel that individual in front of me. So I now know after having um, spoken to energy healers and people who actually make a living of acknowledging that they are connected to the information field and that they operate in an interdimensional existence. Um, and, these are called energy healers or Reiki masters or whatever title it is that they choose to give themselves. But one of the titles that people who operate in the system call themselves is medical intuitive. So I now recognize that I have got that intuition, as we all do, but the system trains us to squash it down so that we are disconnected from it because that might actually give us a clue as to what's going on within ourselves. But what used to happen to me, and the part of the reason why I was such a successful doctor, was when I would ask people questions about what was going on, I would go through the standard history, which I'm going to show you. I'm going to give you all of the inside scoop about how doctors operate and give you the little cheat sheets and all of that sort of thing. It's in a few slides. But I would ask them questions, and as they would be talking along, they would suddenly start speaking about, uh, I'd ask them a question, then they'd say this answer, and I wouldn't feel anything. Then they'd say this other answer, and all of a sudden I would start feeling this tingling in my body. And I knew from past experience back then that they were on the right path. and that they had just identified what was the root cause of whatever was going on within them. And I now know, after having left medicine and done further study into areas that weren't permissible when I was a registered medical doctor, that that signal that my body was giving me when I could hear what they were saying that was true to them was actually my sacral authority that was letting me know that, yes, we were on the right path. Yes, yes. It was really, really powerful. So I, for many, many years, tried to dismiss that whenever I was, amongst a cohort of other doctors or explaining to my registrars who would look to me for teaching. I just wouldn't explain that to them at all. But it became a big part of why I was so successful, because my reputation was as a really, really great diagnostician. Like people, my colleagues used to beg me to take on patients that they just couldn't work out what the hell was going on. And I mean, I was a GP, so I wasn't meant to take referrals from other doctors, but I kind of did on the side. I would bypass it through my closed books status and take one for the team. This is a difficult patient. Can you help me, Jen? And uh, and it was because of my medical intuition that I was able to then help them to get to the root cause, albeit then at that point we were still all constrained within the system wherein we could only use particular diagnoses, labels, treatment protocols, etc. But it was something that I recognize contributed to my success as a doctor, my medical intuition. And where I say disconnection is that you have that too. So when you have your body giving you a signal again and again and again, and you choose to, rather than tuning into that and saying, well, if you're coming again and again, you're trying to tell me something, you choose to go Dr. Google or go see a doctor or go see a chiropractor or go see an osteopath or whatever and manage that symptom, then what you're doing is you're taking that signal your body has given you and popping it into the system. So, what being unpatient is about is bringing that signal back to say, that's part of me. Body, what are you telling me? And there's lots of different references that can help you to work that out. Does that make sense? Good. So, going back as to where it all came from, when I was thinking about it, because so many people in this community in particular recognize that, let's face it, there's vested interests within, and follow the money, what everything's all about. And um, there's absolutely this there's this subject in first year med, and it was a beautiful subject, history and philosophy of medicine. And we learned all about Galen and ancient Egypt and all of these different medical techniques through the history. But you know what we were not taught anything about? And I found out about many, many years later and became really, really irate and incensed. We did not learn anything about the Flexner Report. And I think when I've presented to this group once previously, I put some slides up about the Flexner Report. And if you're not familiar with it, the Flexner Report was commissioned by Andrew Carnegie from this guy, Abram Flexner, who basically went through and said, this is how you teach doctors to become glorified drug pushers. It's the only way I can say it, honestly. So Rockefeller, who was a oil magnate, had all of these byproducts from mining oil, petroleum byproducts, and they turn these byproducts into drugs, pharmaceuticals, and they're like, well, how are we going to, create a market for this? Because waste not, want not, here we are making oil, there's these byproducts of producing oil. What are we going to do with these? So petroleum byproducts are the basis of the majority of pharmaceuticals. So the Flexner Report was the vehicle which translated into policy for funding and curriculums for medical schools and hospitals that then trained physicians from that point onwards, in 1910 onwards, as to how they would teach. And if you didn't toe the line, then you were ostracized. So pre-Flexner report, physicians used to be, trained in naturopathic medicine, osteopathy, chiropractic, all of these different alternative holistic healing techniques. Post Flexner report, all of that, you look at it and that's it, you're out. So it was very interesting that it was 1910 because, that took some time to come into legislation and flow on in effect. And then 100 years later, we had a very similar experience in 2019 in Australia, wherein the APRA, the Medical Registering Authority in Australia, tried to make it that there was one set of rules for doctors who towed the line and did everything according to the Flexner report, and one set of rules for those who had already discovered some of this ancient wisdom that was coming through. Because let's face it, patients were looking for it, and they still are. So, yeah, and the naturopaths and the herbalists and all of those other alternative practitioners were just like shunned. So, erase them from society, a bit like eugenics, when it comes to health. So once I learned about that Flexner report, which by the way wasn't until around about 2019, the question that I couldn't shake was that, if my education was shaped by a vested interest from the start, what else was part of the way that I was functioning that I'd just absorbed without questioning it? And that's when it really started giving me some sleepless nights and contributed to this, real moral sense of how can I keep on going in this system when I recognize all of the flaws? And it's something that, well, I just decided not to struggle with because I decided to choose a different path. So yeah, so I've kind of explained that. And so now where that took me to with that recognition was that, the sickness industry or the healthcare system was actually not designed to produce healthy people. It was designed to produce patients. And patients are people who keep returning back to their healthcare professional, who depend upon them, and they are just outsourcing their authority indefinitely. And as I mentioned, the word patient comes from the Latin patiens, which means literally to suffer and endure and to wait. Now, I don't know how many of you are comfortable with that terminology, but I certainly am not. And the fundamental basis of being a patient is that you are not trusting in what yourself is giving you. You are instead outsourcing your authority to others and being disconnected from those signals that the body gives you. So now I'm going to say to you, I recognize the irony in all of this because now I am a coach, okay? And when from my business coach I learned about this concept of the lifetime value of client. And I said to my coach, I really want to help people to get better so that they're not dependent on me on anymore. And my coach said to me, well, I want you to reframe this, people who keep coming back to you and purchasing your services and things like that. Think about that as being the lifetime value of the client. And I'm really, really very ironic because I recognize that that was one of the things that I recognized about my patients keeping on coming back to me that made me think I'm keeping them in this cycle of dependency. And then I became a coach, and my coach says to me, well, you actually want people who want to keep buying from you because they've got high LVC. So I'm completely aware of the irony, and I really wanted to speak to you about that because, the difference between this is, yes, I am the individual who's selling services to help people stop outsourcing their authority, but the difference is intention because my intention is, yes, thank you, Joyce. My intention is ultimate self-sufficiency, not dependency. And I just want you to know that I do feel that tension. So my big idea is that you're not broken, you're just disconnected from yourself. And once you recognize that, then that changes everything. So the idea is that you're not going to go looking for more supplements or become more disciplined or look for other healthcare opportunities. You're actually going to be starting to insource. And that will mean that you are on your journey once you're starting insourcing. So healing is not a destination. Healing is a journey. And it begins when you stop outsourcing your authority, which is why I was originally attracted to my self-reliance in the first place, because it's all about being self-reliant. So the false belief that I want to counter to you is thinking that, I'm broken. There's got to be something wrong with me, okay? Because this is the most costly belief of the entire healing conversation and the sickness industry, because it keeps you in that system looking for the answers that are actually living inside. And what I mean by that is that when your body is giving these repeated signals, then listen to that, because repeated signals from one part of the body tend to indicate a recurring pattern. And we have these patterns lodged within ourselves that keep us in these behaviors, keep us telling ourselves these stories. And these are the things that we can look at changing. So symptoms are communication from your body, as opposed to how the sickness industry views them as being a malfunctioning. So if you keep getting a urinary tract infection, don't think that that's because there's something wrong with your bladder or something wrong with your kidneys. Think about it, that that is a communication from your body, which is indicating something else going on there. Like, try and take it out of this medicalized paradigm. And, our this concept of dis-ease has replaced the disconnection. So when you stop hearing that signal and you go, oh, that's just my irritable bladder or my irritable bowel, then you just stop hearing the signal. But the signal doesn't stop, it keeps on signaling. Okay. And you continue to erode your own self trust in your body, sharing with you what is going on. So it says for me to share a story, but just because of time, I'm not going to share a story. I'm going to tell you about the second false belief, and that is that, oh, look, and people used to say to me this all the time. They come to me and they go, oh, what do you think's going on? And I go, well, what do you think is going on? They go, I don't know. I'm not a doctor. So that is a great indication of this false belief. That is, someone outside of me knows me better than I know myself. Well, that is how the system designs you to feel. It is not an accident. This is an indoctrination that is placed within us from a very early age. And it is this continuation of this outsourcing, which is an over reliance on external validation, which just causes you to continually be disconnected with yourself. Perfect example, my stepfather was telling me at a recent family gathering, they had their first aid upskilling, which he's a school teacher, he has to do every year. And the latest one this year was, oh, look, when someone comes and there's a stick stuck inside them, oh, don't touch it, just take them to hospital. Don't do first aid, just take them to hospital. That's the first aid. Oh, mindless. So, yeah, it's just a great example of the outsourcing culture. Um, and so I want you to know that this is a training, that this is a learning. You're not born to outsource. We're actually born to be inherently self-reliant and self-sufficient. And our old wives' tales and traditional healing methods are all about communicating with nature and recognizing that the body is intelligent. And, when we connect in with our intuition, that is not mystical. It's actually acknowledging the fact that we are really intelligent bodies and we have these signals that happen there, and we will act for it innately at the body level, and then our cognition kicks in. So it's a great thing to recognize that when that thinking's kicking in, don't listen to it, listen to what your body is telling you first, because your body will act so much quicker than your thinking is. Okay? Yes. So in the 6 minute appointment in the Australian medical system, with the 6 minute appointment, 6 minute medicine, I remember a long time ago when that first came in, the question is who is the authority in the room? Well, it's the one who is making the business run based upon the timer on the consultations. And notice that your consultations are rarely ever 5 minutes. They're always over 6 minutes. I'll tell you why that is. It's because there's about a 20, probably $30 difference between a under 6 minute versus an over 6 minute consultation. Okay, so let's have a little look at a practical example. I told you I was going to give you the clues. So these are inside the consultation room. Okay, so this is what your doctor will write down. I'm going to give you a little bit of translation here. So just in case you happen to see your doctor's notes and you see HPC, what the hell is that? That's history of presenting complaint. Note that word. Okay, nobody ever goes to a doctor unless they have a complaint. So they want to know what it is your problem. Then they want to know your background. If they've never met you before, they're going to ask you about what's happened before in the past. And then maybe anything like that in your family or any other significant things, looking for things like cancer, heart disease, diabetes. Then your social history. What are habits? Do you drink? Do you smoke? Do you exercise? What's your diet like? Then on examination, what do you look like? You know, man of stated age. Do you look your age or do you look younger than you chronologically are? And then the examination is directed towards the system that this presenting complaint is related to. Then they'll have a talk about your differential diagnoses and make a plan for management. So this is what your doctor writes down when you go to an appointment. Now, I wanted to contrast that with what I do now as a coach. And this is a very busy slide, but I just wanted to say, give it to you. And this is literally translated from my coaches. And yes, 100%. We have, with Joyce, I agree with you completely. This is exactly how we've been conditioned, and that is exactly my point. This conditioning, this indoctrination starts back in school. This is not something that we by choice take on. This is from a very early age. But this is the coaching framework. So I just wanted to flip it up there to show you that coaching is an unregulated industry. And this is my coach's suggestion as to how coaches should look at making a sale. So really, build connection, and obviously there's still a complaint, how can I best support your goals or changes you want to make? But notice that it's all about where you are at this point A and you want to get to point B. So I've got a permission frame. It's not like you've come to me wanting advice. I know that if we are a good match, I'm going to sell you. There's no, beating around the bush about it. It literally is quite open, and it's a process that is very different from that wherein when you go in this state of fear into a doctor's appointment and if you're not able to step out of the fear and put yourself into this place where you are in control, then you will be subject to the time pressures and feeling like you're in the fear and you don't know what's going on. In a coaching framework, you are recognizing that you are the center of your universe and you are the only one who can affect change. So that was the main point that I wanted to make. And also the fact that it's a lot simpler being a doctor than a coach. The third false belief that I wanted to correct is the concept that when we are healing, it means we're fixing. Because if we are thinking that we are going to be fixing you, then you're just a problem to be solved, a patient to be managed. But healing is not a destination. Healing is a journey. It is you choosing that you are going to be getting you to where it is that you want to be. Not just that there's something wrong with you, because there isn't anything wrong with you. You are unique and your body is giving you signals. So healing actually is remembering the point that you were making beforehand, Judy and Joyce, is that yes, we've been conditioned to this. So you can't, what happens is when you're young and you have these events that happen in your childhood, during which time your emotional needs are not met, what happens is that they lodge in your body as a significant emotional event. And associated with that becomes some kind of negative meaning that you draw about yourself. And stored in with that event is a whole heap of emotions that, the body keeps the score. So it's often not acceptable to, as I was doing at the beginning of the conversation, be crying and bubbling on, or being angry, or being fearful, or whatever these emotions. So your body suppresses them down as stored emotions, trapped emotions. And then from time to time, to avoid getting in touch with those emotions again, a situation will come up in which they are uncovered and you feel unsafe. So, to avoid connecting with that emotion, you adopt some kind of a strategy or a pattern that then keeps being repeated if that avoids you connecting with that negative emotion. So, you aren't going to change all of this until you can feel safe back in the beginning. So when I started talking to you, I didn't feel safe because here I was, I've got to talk about being a doctor again. And I'm just not comfortable with when I was being a doctor. Now being a coach, yeah, that's great. I love it because I only work with people who want to take responsibility for recognizing that they have all the power within themselves. I'm just going to facilitate them to see the way. So it's all about integration. It's not about management. It's about returning to yourself underneath all of those stories that you've told yourself. And it's returning, that is the unpatient way. It's recognizing that you have been conditioned. Exactly the words. I'm so pleased that in the chat you found those words. So that's where I talk to you about the insourcing method. And there's 3 stages of this. The first stage is feeling safe, and that involves regulating the nervous system. So that means when you come into a consultation, you've got to take some time to prepare yourself. And it's okay if you become tearful, because if you become tearful, let it out rather than trying to suppress it, because emotion is just energy that needs to move. And what that will do, it might take a little bit more time, 30 seconds, 60 seconds, but the health professional recognizes that there is pain and suffering there. And it's all about what's important to you at that moment. Then, once the emotions let out, take a deep breath, get yourself into that place, look at your notes, and the insourcing method can happen in a consultation, or you can do this on your own. You don't need to use the notes that are just going to give you the bits that they match up according to that history that I told you about. You can also choose to be aware of those subconscious patterns that have been running your show for you. And once you recognize those subconscious patterns, that's wherein you can start to release them. And then the final stage after you've released is to actually reconnect with what it is that is true to you. And living from your inner authority, that basically means, like, when I recognize that, hey, I get a signal when people are on the right track, I get this in my lower legs, and I'm like, oh, yes, this is it. We're on the right path. Here's the root cause. Let's pursue this a little bit more deeply. I still get that when I speak with people to this day, even though I'm not a doctor, which is fantastic. And that's because it had nothing to do with my training in the system. It's actually part of my design. It's my inner authority. It's called the sacral response. Anybody who's familiar with human design, put in the chat if you're familiar with human design, because once I learnt the language to name what was going on with regards to my medical intuition, it just all made sense. And I'm like, oh, there's a label for it, or there's a language for it. And I now recognize that that's what it is. It's been guiding me all these years. So grateful for that. So the first thing with the insourcing method is you've got to be safe. Okay. So you cannot think your way out of a dysregulated nervous system. So the first thing is that you've got to feel safe. So I said about taking a deep breath. Obviously, breath is life. And when we are regulating ourselves, one of the easiest ways to do it is to be consciously aware of your breathing. And if we are not allowing ourselves the time to become consciously aware of our breathing, and we let the emotion move, then we may just need to have a big release and a bit of a cry and then bring ourselves back with some breaths and say, thank you for holding space for me. I needed to release that emotion. Now I'd like to present this to you and move forward from that space. So thank you for allowing me the time to do that today. So, yeah, that's all I want to say on that stage slide. The second pillar is being aware. So, as I was saying, if you are able to, you can become aware of the recurring patterns that go through your life. Now, in the health system, they're not going to be interested in this. Okay, so this we're talking about insourcing method when you're doing it for yourself. Going and trying to explain to your doctor that I notice that every time that I have a stressful situation, I get really nervous and I have to run to the toilet and have my bowels open. Well, they're going to say, oh, you've got irritable bowel syndrome. There we go on a low FODMAP diet, blah, 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 blah. There's your protocol, right? So that's within the system because this is a program that's inside you. So there's some kind of a stressful situation as you're perceiving it, and then you get this fecal urgency. It's a really common pattern. That's why I chose this one. It's been something that I've seen in so many patients over the years. People who won't leave the house because they're so fearful that there won't be a toilet wherever it is that they're going. And when they become nervous, they need to run to the toilet. So, this is a pattern which the system will have a label for, but by insourcing, you will recognize that you can't keep avoiding stressful situations. Your body is giving you a clue as to, yes, you find that uncomfortable. The question is why and how can you move through that? How can you release that? What are the deeper meanings that you're taking on about yourself when you put yourself into these uncomfortable situations? Because 95% of the behaviors that we have in life are actually driven by programs that are running below our monkey mind. They're programs that are running in the deeper parts of our brain. And I just wanted to bring up that, when I told you about my intuition and learning about the language for that through human design, I'm not saying that, that's a absolute or anything. I just found it really curious that I finally had some language to explain what was going on within me the whole time, because our body is so intelligent. It is giving us these signals. And if we want to find language to explain it, sure. Or guess what? We can just pay attention to it and tune in to the feeling that we have and observe the patterns and be grateful for it. And then, if there's patterns there that are giving us discomfort or disconnection, then look at addressing what's deeper underneath them to allow yourself to be on the path to true healing. I hope that makes some sense. So the modalities that I use for that are things like NTT and human design and subconscious work. And then the third pillar is actually returning yourself to whatever it is that feels right for you. And that is your inner authority. And I'm borrowing the language from human design purely because it's been so appropriate for me. But that doesn't necessarily mean you need to use that. You may just remember that, hey, I'm someone who loves to give to others. Well, that's fantastic. Are you doing that because you have a deep longing to be needed? Or are you doing that because your cup is just so full that it's overflowing and you're just giving, giving, giving? Make sure that there's balance in your life. And this is wherein you can feel whole. You can feel that life is brilliant. I don't have anything to prove. I've released all of these stored emotions within myself and I'm just loving life. I wonder if there's anyone amongst this group tonight who feels just like that. If you're brave enough and tell me that you don't need any releasing and it all feels perfect and life is fantastic, stick a heck yeah in the chat. I'll be really surprised if I see any. But just imagine that. Imagine if you woke up and the very first feeling that you had was just peace and serenity. You didn't have to go researching and worrying about these things and checking your to-do list and wondering what's going on today. You were feeling completely regulated. You were making all these decisions from this inner knowing. You didn't need to ask anyone else's opinion, and you'd had the most beautiful sleep. And it was like, ah, what a wonderful day. I just can't wait to face it. Wouldn't that just feel so fantastic? Hmm. So the point is that most people are not there. And you can recognize that these are patterns that you're there and you're living. And when you recognize it and you comprehend it, it doesn't mean that you're actually living the change. You can see it, but to get to there is sometimes really, really tricky. And the conditioning and the indoctrination causes you to just not trust yourself enough to act to get to that point. So the point is that you can know why all of these patterns are there, but it's not the same as knowing how to release, resolve, and realign. So I'm going to ask a question. Can I show you the how? Is that okay? Can I have a yes in the chat if you're happy for me to show you the how? I can see people typing. Thank you. I appreciate you. So some people can do it on their own. Okay. And that's part of the reason why I wrote the book, because, this was such a helpful process for me when I learned this. But as you can see from my very initial start, I still have some work to go. I'm not perfect. I never will be. Healing is a journey, not a destination. But the reason why most people struggle is because those subconscious patterns, you can't see them, especially if you remain inside the system that has helped to create them. And this is not because you're not intelligent. It's actually a feature of how the subconscious works because it's a protective mechanism. Okay. The strongest part of the brain that is responsible for our behaviors and beliefs and values and all of this sort of stuff can't actually be accessed consciously. Consciously, we've got access to about 10% of our brain. 90% of our brain is working behind the surfaces. And, you don't have to think in the morning that you need to go to the toilet or you brush your teeth or you wash your face or whatever. That's all subconscious programming. And it's within the subconscious programming that these habits and patterns live. So, wherein those are that are telling you stories that are causing you to behave in particular trauma response patterns that maintain the disconnection, that means subconscious work to clear and release the stories behind this. So, when we talk about recalibration being guided, that's not a crutch because, as I've already mentioned to you, I'm not talking about hanging you on and being clients forever. I'm talking about getting you the fastest route to back to remembering what it feels like to be in the space where you can do this yourself. So it's a shortcut, not a fix. It's a shortcut to coming back to yourself. So the next step is actually, if you are interested in going further with this, one conversation with me that I used to offer for 40 minutes for free. And then I realized there's only so much time in the day. And I know that when people have listened to me go through this presentation, we can talk together in 15 minutes. So 15 minutes of my time for free is called a health clarity and advocacy call. So it's not a sales call. It's a structured conversation to identify exactly where you are and what, if anything, looks like the right next step for you. So you don't have to perform. You don't have to give me your whole story. You got to think about what patterns am I noticing in my life and where am I getting held up within the system? And if I still need the system, how can I best navigate that? Well, hopefully, I've given you some tips for that tonight already. But if you're ready to go deeper, then is that something that you want my assistance with? So I've got a little QR code there for you. So if you are interested and you would like to speak some more with me, then there is that booking link there. And you'll notice on that booking link that there are actually two choices. One is to book into the free masterclass that starts on the 6th of June. And guess what? This has been my first run of the free masterclass. So thank you so much for letting me run through my slides. And I'd appreciate your feedback at the end, and we will have time for questions. And the second option is to, if you are ready to actually have that one-on-one private confidential call, then book that in with me. So, in the 15 minutes, what we might do is we will, number one, work out where you actually are, not where you think you should be, but where your body and your nervous system currently are. And then secondly, we'll look at what is actually running the pattern. So what is that single mechanism that's underneath your exhaustion, your override, or that gap between where you are and where you feel like you should be? And then we'll work out which pathway fits. And I've got a couple of paths, which I'll talk to you about next. And then I will let you know what I feel like would be the honest next step for you and whether or not it's aligned with you. And if it's not aligned, I will just tell you that. I'm not into working with people who I don't feel a resonance or an alignment with, because it's a waste of both our times. So there are the three pathways. The first pathway is the health clarity and advocacy. So for people who are in that system, maybe because they have got chronic disconnection. Oh, sorry, did I say disconnection? Chronic disease, are labeled, have diagnoses, are dealing with health professionals, and want to stay within that and just get some support to make sure that they can get their health professionals to be giving them exactly what they want, then that's the path for them. And I have a 3-week intensive for health clarity and advocacy that's very, very well priced. I then have the insourcing method that I offer for people through a 6-week, 10-week, and a couples program. And this is deep nervous system work, shifting subconscious patterns that then change everything. And I then have a third pathway that originally, starting May, I was planning on being my solo offering, but then I realized that there's a big gap, which is called health clarity and advocacy, and I can't leave that gap. I can see that I can assist to fill that. And full transparency, if I can assist people who are having difficulties with their doctors, part of the reason why they're going to be having difficulties with their doctors is because their doctors are needing help too. So my third path, which is the specialist path for medical professionals only, I am hoping that a lot of my referrals for those doctors is going to come from the people who choose to work with me for health clarity and advocacy. Does that make sense? Yeah. So the call will just identify which of those three pathways is yours. So at this point, you already know whether you're ready to step out of the waiting room or you're going to keep waiting. But the waiting room's empty and the call is free. So that's the only next step you need to take. And it's not about finding your answers. It's all about becoming someone who trusts themselves to live those answers. The Unpatient Way. I would love to see as many of you on that call who would be happy. And I have got some time for questions and answers. And I did start a little bit late, so I hope that that's okay, Kelly, if I open up to questions and answers if anyone has any.
Yeah, thank you, Jen. I think that was such a beautiful presentation, and it really hit a lot of a nerve. I'm going to say hit a nerve with a lot of us. Can I just quickly, while people are bringing in their questions, and you can put your hand up if you want to ask a question of Jen, but I want to share a quick story which really highlights what Jen was talking about. When I'm just going to bring myself on the pin. So when I was a teacher, I was teaching special needs students, and I was only teaching casually, and I'm kind of semi-retired. And this was right around before COVID. I had a student in the class, and she was quite aggressive, and it was right on bell time. And she grabbed my hair, and I had it in a plait at that time. And she grabbed my hair, and she wouldn't let go, and it was really tight. And I was like, I had to just hold her hand next to my head so that she wouldn't just pull my hair out. And it was kind of traumatizing, a little bit rough. And eventually someone came in and pried her fingers off and this kind of thing. Anyway, that led me to going to the doctor and getting a referral for workers' compensation and getting treatment. And so I was getting physio treatment. Now, I love my chiropractor, physio's great. And what I would notice is, like at the beginning, there might have been headaches and so forth. So I was getting physio treatment, and I thought this was actually, thank goodness for workers' comp was covering the cost of it. Great. But then I realized I had to, if I wanted more physio treatment, I had to go back to the doctor and I had to talk about my pain and where I was feeling pain and go into that, and then I would get more treatment. And after a little while of this, even though like the headaches were getting less and further apart, and I might have still been feeling them, I started to realize actually I could either play the system and keep getting treatment, and and they were happy for me to play the system because I could blame the headaches on anything, and I actually think that some of the headaches were due to my mattress or whatever, right? I could just or not drinking enough water. But I started to realize that the more that if I played the system, I became a victim, and the victimhood, that cycle, was starting to really play into other conversations and left me feeling that a victimhood. And so what, I was very clear. I wrote a journal entry about it, that one day I decided this is not healthy for me, even though physio is kind of could be classed as good for you. I'm like, this is the whole system, the framework of doing this is not healthy. And so if I want to go to physio treatment, it's better that I pay for it than if I rely on getting it for free, so that I could take myself out of that victim mentality.
Mm. Gee, that's a great reflection. Yeah, yeah.
Mm.
Thanks for sharing that.
Yeah.
Mm.
And I think that's
Yeah.
how you become an unpatient, right? You
Mm.
have to take back your own empowerment to go, hang on, where is this coming from? What's actually going on inside of me? Do I need the chiro or the physio continually? Or am I okay now and I can just give up the story? Because at some
Mm.
point that was a story that was I was hanging on to, and I just let that go.
Yeah, yeah. And did you let go the story as well? Like, did that actually, by choosing not to have the physical therapy, did that help you with the emotional consequences of that situation that you were in and how that child must have been to be in such a place where they would do that to a teacher?
Well, that was special needs. So it
Hmm.
was an unusual circumstance, and she's that like I can't hold that against her because that's
Mm.
part of her makeup.
She was craving your attention.
She was,
She didn't want to let you go.
yeah.
Yeah, she.
Yeah. Look, did I heal from that? Well, it was kind of like a nice segue out of teaching,
Mm. Mm.
actually,
Yeah.
because then I started doing my self-reliance, and
Mm.
the rest is history. But um, I found like I didn't need to keep going back to the school and let go of a lot of stories I could let go of.
Mm. Yeah,
Yeah.
fantastic. So, does anyone have any questions for me or a share, perhaps like Kelly's share, which was fantastic?
I also want to say that Jen is an excellent coach. And so when you work with Jen, you can really empower yourself in what it is that you want to achieve for your health. So don't feel afraid to, take up that 15 minutes because it's super valuable.
Yeah, yeah. The 15 minutes is no holds barred. You can talk about whatever it is that you want to talk about. Like it's, my time that I'm giving to you. And, I'm not afraid to, I do like to say that it's not about um, dissing on the medical system, but you can kind of hear from the undercurrent that there's a fair bit of cynicism that I have with regards to the system.
Do you have a
So
link to Jen? Do you want to put a link into the chat?
yeah. My QR code was there in the thing, but yeah, I'll put my little booking link in the chat so people can copy it down if they like. It's nice and easy to remember, so that I can even type it out myself without making any typos. So yeah, and that's also, as I said, it's a link to the gateway page that gives either a booking link for the free 15-minute call or a booking link for the masterclass that I'm going to be running 3 times a week using those pretty well exact same slides. Did they project up okay? Were they all legible and made
Yeah,
sense? And yeah, yeah.
yeah, they're great.
Yeah, I feel like now that I've done it once, I've released that emotion from that original, at the beginning. It's like, so much better. So
Yeah.
yeah, yeah. And it's yeah, interesting. I love to say not a doctor. But I probably should change my name to say Dr. Jen Draper, former medical doctor, because it's quite interesting that once you have relinquished your registration in Australia, it's very important. You can still use the title doctor. You just have to make sure that people recognize that you are no longer registered, no longer practicing, cannot give medical advice. And so that's the reason why when I'm talking with people, I love to, yeah, I've given up my registration, Joyce. I just said, APRA, that's it, you're not getting my money anymore. I refuse to buy into your club. Yes, that's the way to do it. And, but you never, yeah, undoctor, I call it not a doctor, like, shh. Yeah, it was difficult, but I have to admit that the part of the reason why it was an easy thing for me was I recognized that each time when I put myself in that space of thinking like a doctor and thinking about going back into the consultation room and stuff, the tears would just come. And there were certain things that I used to answer to patients during the end of my career, like, for example, when they would ask me, well, what's your opinion? I'd say, opinions are like assholes. Everyone's got one. What makes mine smell any better than anyone else's? So, I mean, that's very facetious and very disrespectful, but that's the point at which I was at in answering those questions. People would also ask, well, what's your opinion with regards to XYZ? And I'd say, well, what does the public health department say? Maybe do exactly the opposite of that and you'll be on the right track. So I realized that, this was kind of incompatible with general practitioners being the agent of the government, the conscious agent of the government. It's nothing subconscious about it. It's overt. You've got to meet certain targets, and it's, yeah. So, yes, I completely agree. And something further to what you've said, Andrew, is
Do you want to just read out what Andrew said?
yeah, so Andrew has just written 2 very important points I'm taking from this. Number one, how much our subconscious affects all areas of our life that can be buried so deep we don't even know they are there, but yet they manifest themselves. Well, yes, I actually have a slide that I speak to with people wherein it shows that 90% of our behaviors and emotions are actually controlled by the subconscious parts of our brain. 10% is our monkey mind. So here we are speaking and stuff, but there's so much else going on behind the scenes. And when you think about it, think about all of the information that your brain is processing. I don't know how they've measured it, but I've seen it quoted that there's like 11 billion bits per second of information, and your brain can't actually process or express that much. So, in order to be able to express as much as you can, which, let's face it, even if you're a fast talker, you can maybe only say 150, 200 words per minute, you've got to condense all of this information down. So, what do? You delete, you distort, and you generalize. And how you do that is completely dependent upon your subconscious, which is completely dependent upon your lived experience and the stories that you're telling yourself. So, number one, I completely agree. Second thing Andrew wrote was how victimhood robs us of our power and how easy it is to fall into because it seems to satisfy one part of you. Well, victimhood is one of the trauma response patterns that we observe within people. And when you learn about trauma response patterns, and I have a list of them, so I'm just going to read it out, but I'll have to stand up to read the list. No, I'll just lower my camera down a bit and then I can read it. These are trauma response patterns: criticism, contempt, stonewalling, defensiveness, denial and blame, low empathy, gaslighting, codependency, people pleasing, dissociation, angry attacks, shutting off parts of yourself, pain body enjoyment, beating yourself up, control, and last one, victimhood. So that little list that I read is a list of, and it's probably not a definitive list, it's just the ones that I have up on my wall to remind me, although my computer is blocking them out since I got my new computer. Um, they are patterns. So when we say what patterns are causing you a disconnection from your true self, patterns are not your true self. Patterns are things that you have learned. And they're what those patterns do is if they meet at least three of the five basic human needs, which, once again, looking at the same slide, five basic human needs. Number one, safety and control. Number two, challenge and change. Number three, feeling like you matter. Number four, love and connection. And number five, soul expansion and contribution. If whatever pattern it is that you have, like your victimhood or your gaslighting behavior or your codependency, if that meets three out of the five human needs, then you will keep repeating that pattern, because by repeating that pattern, you no longer have to connect with the stored negative emotions in your body, which were created because of the stored negative meanings that you took on because of some kind of significant emotional event that happened in your past or your past life or your past generations, during which time your nine emotional needs were not met. So being seen, being heard, being validated, being loved, being accepted, belonged, all of those things, when they are not met at some particular event, in other words, you didn't have a strategy to deal with that event at the time in the past. So it was too painful for your consciousness. So it got shoved down into your subconscious, which equates with a part of your brain called the amygdala. And the amygdala is not consciously accessible. The body keeps the score. So the body stores these emotions and gives you these signals that you feel, and you go, oh, that's just my irritable bowel. Ignore that. But it's just something from your past you just don't want to connect with. So the process that I go with people goes way deeper, not in terms of retelling your story, because who wants to re-traumatize, but by accessing the subconscious and choosing to allow the lessons that come from releasing those stored emotions. So it's a very powerful process. And this process is also called the warrior method. And it was used by combat people who had been in combat and had PTSD and things like that, and all these stored emotions within their body, and they were stopping them from getting in everyday life, and it's been used very effectively through that. And so various different coaches have taken it and NLP principles and then incorporated that all into this method that I'm certified in called NTT. And it's a really, really powerful method. So I really enjoy helping people with that. So yeah, hope that answers lots.
Yeah, I have another point that just came up to my mind when you mentioned about the brain's ability to absorb information in your subconscious without you realizing it. Um, I think particularly the freedom community is prone for this because we tend to do a lot of doom scrolling. So we're absorbing information in our subconscious that we don't even realize, and it affects us in a negative way that we don't even know the depth of.
Mm. Well, to that, what I would remind people of is that where your attention goes is where your energy flows. So the more that you focus on something, the more likely that is as a truth. Because the concept of reality and truth and imagination and all of this, our brain is an incredibly powerful, energetic part of our being. We have this concept I mentioned about the three, but I didn't go into too much detail. But we have this 3D existence of ourselves, body, brain, etc. Then there's the higher self, which is interconnected with all of us in the oneness, the information field, spirit, soul, whatever is the language that you choose to use. And then deep below is the subconscious, the stored trauma, the inner child, various different names for it, the id. So the id, the ego, and the superego, if you're a Freudian follower. But the neuroscientific basis for where your attention goes, energy flows, it's all about quantum physics, but it's also the fact that there's a part of the subconscious brain, and it involves into the cortex as well, that is called the reticular activating system. Has anyone heard of that? The reticular activating system? Yeah. So a great way to explain that is whatever you start paying attention to, you see more of. So when we decided that we would get ourselves a Mustang, guess what we saw on the road everywhere? Mustangs. So it's a where your attention goes, your energy will flow. And what you perceive is exactly what you are projecting. So once you realize that power that you have within yourself, then you can start to be selective about where you focus your attention. So that's a really good point, Andrew. Thanks for saying that. Any more questions?
And that is so powerful. That is the reason you want to do this program, is because it just allows you to understand how the mind works and how powerful you are, and that you are in the driver's seat all the time. If you don't like the circumstances of where you're at and what you're seeing and how life's treating you, guess what? You have something to do with it. Which is such a good
100%.
thing. It's a good thing because it means you can have something to do with it, right? If it was out of your field of experience, control, then you'd be the victim, and then you would have nothing to be able to do with it. But because we do have something to do with it, then we are in the driver's seat. It's really
Yeah,
great.
absolutely.
So
Very good. Awesome. No
well,
more
thanks.
questions?
Yeah, thanks
Great.
so much, Jen. We
You're
get a bit
welcome.
quiet on a Tuesday night.
No, that's it's
I'll reach
really
out to you.
good. And I think it's wonderful that you record it and send it out to the community, because then people can, if they have a spare hour, they can watch. Although I think we've been an hour and a half tonight, so good timing to me for pitching the slides. There's a couple of them that I'll get rid of in there. Thanks so
No,
much for
so
helping
good.
me. I
So
really
good.
appreciate you.
We know we're so excited to have you. Thank you so much for your time and for all of pouring your love and energy into us tonight. We appreciate that. Was made a huge difference, I'm sure, for many listening in. So,
Very good. Thank you.
all right. Well, hopefully we see you at the weekend at the Tiny Homes, and and I, just by way of announcement as well, I've just released a new retreat, our first retreat at Lily Pond, called uh, Voice to Vision Leadership Retreat. So it's all about getting your voice out there and be able to, if you're a bit shy, to come forward but you have something to share, which you all do, then come along to the Voice to Vision Leadership Retreat, and we get you comfortable being in front of and talking in front of others. So it's good. All right. I'll see you all next week, if not before.
Thank you. Amazing.
Thank you.
See you later. Very good. Thank you.